Hello everyone, and this is part 2 of the video clip that I've promised in continuation from the part 1 that I just presented earlier on. So part 2 we'll be talking briefly about what is non-invasive ventilation and what does it comprises of. Okay, so let's start the ball rolling, and to make things very simple, basically non-invasive ventilation, or some people call it more commonly as BPAP. So BPAP itself, it comprises of few components. This is the machine that you see. I'm just going to move it a little bit back so that you can see. So this is the machine that you can see, and this is where the extra component that is attached to the side of the machine. This is a humidifier. Then you have the this is a wire socket that connects to the AC power. You have the tubing over here. This is the tubing that connects to the back of the machine. And of course, you have various types of masks available. Okay, so why is it called non-invasive ventilation? It's important to understand. It's because the ventilation, assisted ventilation itself, is provided through non-invasively. That means it's through the mask, either through the nose that is covering the nose, or the mask covering both the nose and the mouth, that we call it full face mask, right? It's different from invasive ventilation, whereby patients in the intensive care unit, ICU, those sort of ventilations, you will require a tube to be put into the windpipe of the patient. Now back to BiPAP or NIV, non-invasive ventilation. So this is the device. Once you have powered it on, okay, it's important to be aware of this humidifier. You can actually open it as shown here. So there is a marker. So fill it up with some distilled water up to the marker that is recommended. Close it nicely and slid it into the machine until you hear a click sound. Okay, once it's fitted in nicely in this way and the power is on, ensure that the tubing is connected at the back well, and this tubing itself will go to a mask that the patient or you yourself prefers. Most important, it's the mask that you want to wear is the mask that you find comfortable with. And you need to go through a series of testing and adaptation. And this can be advised by your doctors or even the home care providers that come along with you, because there are various types of masks that is available in the market that you can actually test and try it out. So I've actually brought along here with me two types of masks, and it's the common available mask in the market, common category. So the first one, as you can see, this is a nasal mask. Nasal mask means that the mask will cover just the nose. Okay, so various brands have various design. It's important to be aware of, and sometimes the clipping mechanism is different based on the brand that you are trying it out. So how does it go? It's this mask will be fitted on through your nose, just like this. Okay, we hopefully will have a video to demonstrate to you how fitting can be done for 2 persons. Okay, if you are having some weaknesses over your hands, you're not able to do it yourself, you need assistance, we will have another video to demonstrate to you. Okay, once this has been fitted on, just like this over the nose, you should be breathing through your nose, and also there can be some form of leakage through the mouth. This is the usage of a nasal mask. Okay, and why some people prefer this is because it's smaller, and if you use a nasal mask, you are able to speak because the mask itself doesn't cover your mouth. And this is the part whereby you connect through the tubing, right? Just shown like this, okay? Now, on the other hand, an oral nasal mask here, it's the mask that it covers the nose and the mouth. For instance, in this way, if I can show. Okay, so the clipping mechanism or some design in different manner depends on the brand itself. Once you have connected to it, for instance, I've showed previous just now, the tubing connects at the bottom. This way, okay? So different mask suits different people. It's important to be aware that no one mask is the best mask. Okay, the best mask to me is the mask that you find yourself comfortable with. And a lot of time for BPAP therapy, I will always advise my patient or try to explain to them that you will need time to get adapted. It's not something that you can get used to it after using for 30 minutes or 1 hour. Sometimes you can do it at a short periods frequently for initially for 1 hour, for 2 hours, but you need to get adapted over time, right? So we are done with the mask and the machine itself. So in terms of the setting of the machine, you will not need to know in detail, but basically each machine is different. There is an on-off button here that you can see. This is the on button. Once the on button is in, then you have a knob that you can change the setting of the machine. This way, okay. So there are various settings in them that you can actually change. For instance, like how strong is the pressure, what's the humidity level that you prefer, what's the comfort settings. But all this will be advised by your doctors or your home care providers. So once you have used the machine, you just need to press the same button to switch the machine off. And somewhere over here, if you're aware, there is also a SD card that stores the data or the usage of the machine. And some of the new machines like this one, it's linked to a cloud software. So the results can be traced via the internet. It's very much more convenient for your doctors to check your results. And not forgetting, there's a filter as well at the back of the machine. There's a filter at the back of the machine where you won't need to know, but your home care providers will advise you accordingly when to change the filter and when to actually check on the filter. Last but not least, all these machines are very durable. You should use it according to the advice of your doctors or the advice of your home care provider. One of the questions is, patients do ask me, how frequent do I need to service the machine? Recommended is every year you can contact your home care provider where they will come and collect your machine and do a quick service for you just to ensure that they are functioning well and optimal for your treatment. Last but not least, it's important to know that BiPAP therapy is an established therapy to help in hypoventilation. So for patients with motor neuron disease, usage of BiPAP has been demonstrated to improve overall quality of life, median survival. It also helps in slowing down the deterioration of your lung function. So there are many papers or many studies that has been done and demonstrated that BPAP therapy is useful for patients with motor neuron disease. So I am hereby strongly recommend to you that to seek early consultation or early advice from your neurologist or from your respiratory physician as to whether if you are diagnosed with this condition, whether you would need to be started on non-invasive ventilation. With that, I thank you for your attention, and I hope that if there's any questions, you can direct your questions to our MND Society of Malaysia. There is an email that is going to shown to you so that we will address to any concerns that you have. Thank you very much for your attention. Have a good day.